You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to PM&RRecap.com to learn more.
Thanks, guys. I really enjoyed hearing about your guys' program as well, so thanks for that. Hey, everyone. My name is Marla. I am one of the PGY3 residents from MedStar NRH, Georgetown University. Myself, along with our co-chief, Kevin Cipriano, we're going to be talking to you guys today about our program. So go ahead, Kev, we can move forward. So our program, it's got a super long name, MedStar Health, Georgetown University. This is all of us. We're super excited to actually get to take our picture together this year after a year of not having a picture together, but these are our friendly faces. Go ahead. So our program is affiliated with both MedStar Health and Georgetown University. MedStar Health is a huge consortium of hospitals on the East Coast. So just throw that out there to show you guys that we have a lot of support with our program through the MedStar Health system, and then also all the academic support you could ever want from a huge, great academic institution in Georgetown School of Medicine. These are our program leaders. So top left is probably the face that you guys most commonly will see. Dr. Wazotsky is our program director. He, along with Dr. Pindaprolu Sal, who's on the right, she is our program director for our internal medicine program, which we will do our intern year as part of that program. Dr. Maxwell in the bottom left corner, he's our associate program director, as well as our sports medicine fellowship director. And then Jennifer on the bottom right is our program coordinator. So if you're ever trying to get in touch with our program, she's the one to reach out to. She's absolutely excellent. She makes the program run. So just a little bit about us. So we are a categorical program, meaning that we have our internal medicine intern year included within our program. So if you match with us, you've matched for your intern year as well. We take 6 residents in each class, so that's a total of 24 residents. We also offer a lot of fellowships actually at our program, which is very cool. We have a sports medicine fellow, brain injury fellow, cancer rehab fellow. Right across the street from us is Children's National Hospital, which was one of the best pediatric hospitals in the country. It's literally a 3-minute walk from when you leave the door of NRH to the front door of Children's Hospital. So we offer a pediatric fellowship there. And then we also have a NAS accredited pain fellowship at one of our attending physicians' private practice in the area. Just a little bit of background about what we offer in each of our years. So our PGY1 year, the intern year, it's run at MedStar Washington Hospital Center, which is the largest hospital in Washington, D.C. It's the level 1 trauma center for Washington, D.C. So as you can imagine, you see a lot of great things there. It's a great way to do your intern year because there's literally a bridge connecting our hospital, the rehab hospital, to Washington Hospital Center. So we get a lot of our patients from there. So it's extremely helpful to have your intern year over there, and then you just get the same patients that roll right on over to you in rehab. So it's a great intern year. And then we do incorporate our interns over at the National Rehab Hospital. So you'll do 1 month of spinal cord injury with us over there. For our PGY2 year, you really get your feet wet with most of the basic PM&R specialties that you'll need to know. So all of your inpatient specialties, as well as your basic outpatient MSK, your outpatient like sports, and your outpatient pain as well. So yeah, these are some of the guys that we have for our outpatient side. For our PGY3 year, that's when you get kind of even more specialized. So we do our inpatient and outpatient pediatrics. So usually we have an inpatient pediatrics unit in our rehab hospital. With COVID, They're at Children's National right now, but again, that's a 5-minute walk, so it's not really a huge deal. We also do have an affiliation with Walter Reed, where they send their residents to our rehab hospital to do spinal cord injury and TBI inpatient, and we go to their hospital to do EMG. So it's a really good opportunity to work more of like a VA system, and get some different opportunities for different attendings, which is always helpful. We also have an affiliation with the NIH, the National Institute of Health. So we do a month over there as well, which is a really good experience. Very cool, very different type of patients. And then our PGY4 year is very kind of open. So you have your structured like inpatient again, which is a helpful repeat because you do have to take your boards whether you want to do inpatient rehab or not. You have to know inpatient rehabilitation to be PM&R board certified. So we repeat some of those specialty inpatient rotations, and then we do our outpatient MSK, and we have a ton of elective time in our program, absolute ton of elective time, where you can kind of tailor that towards whatever your interests are. So one of our really cool unique things about our program is we have these separate tracks, and the way these tracks work is it's really just there for people that have special interests, and our program director formulated these so that we could really take our time in residency to pursue these special interests. So we'll go over these briefly, but please let us know if you have more questions about this stuff. But we have first one we have is a research track. You have like 4 months of extra, 4 to 5 months of extra research time. A lot of people go to the National Institute of Health, NIH, to do their research, but you can really do it anywhere that you can find a big research project in DC. So that's pretty exciting. Next, we have an ultrasound track. So if you're interested in ultrasound guided procedures, you can substitute extra ultrasound time into your actual education. And one of the residents that actually formulated this track became RMSK ultrasound certified by the time he finished residency, which is completely unheard of. So it's a pretty cool track as well if you're interested in ultrasound. This is my track, so global health track. This is for people that may be interested in doing more global health work once they're done with residency. So this track eventually culminates in a international trip for a month where you get to work in a area of underserved medicine for a month in PM&R. So fingers crossed that we'll be able to do that again coming soon. We have a lot of great sports team coverage. So we do cover the Catholic University College sports. That's one of our main coverages. We do a lot of the different sports teams there. We also do a lot with adaptive sports. Front and center there is actually one of our OTs that's balling out pretty hard right there. But we do a lot of adaptive sports coverage, wheelchair basketball, wheelchair rugby, sled hockey, a lot of really cool stuff. These are just more of our guys at more sports team coverage. This looks like probably football, I would guess, the cold weather. And then just another one of our tracks is the social medicine and health equity track. So given that we're in DC, we come across this stuff all the time. So again, if you have a special interest in something like this, it's another track that you can pursue in our program. And then last thing I'm going to talk about here is we have the way we structure our didactics is on Wednesdays. We have a protected didactic day. So in the morning, that means that we don't round on we write notes that day. We don't carry our pagers that day. In the mornings, we go to lecture. It's all protected time. And then our program director comes down every single week and discusses like what's going on with the program. So you have face-to-face time with him every single week, which is great. Then we have a grand rounds, which is really cool. Last week, we did grand rounds with one of the ENT docs from Washington Hospital Center talking to us about trach management, which is obviously very helpful. And then in the afternoon, we have our resident continuity clinic, which is very cool. Basically, it's your clinic and those patients are your patients. And so you kind of simulates what an outpatient clinic would be like for you once you finish residency. It's a very cool opportunity.
Thanks, Marla. And I'm Kevin. As she mentioned, one of the other chiefs this year. I'm going to hop in here and just get started talking about some other stuff. We have tons of hands-on learning, which is really cool. We incorporate ultrasound into pretty much everything we can. We get a lot of EMG involvement, and a lot of our attendings will actually have us do some different prosthetic and adaptive training while we're working through the hospital. So see what it's like to be an upper extremity amputee, lower extremity amputee, kind of do rounds in one of the wheelchairs, like see what it's like. And it's actually really, really interesting to see that perspective. We do noon conferences every Tuesday, Thursday. We actually recently revamped this whole curriculum, making it very board relevant, doing journal clubs, making a really focused additional didactic program outside of our Wednesday didactics for some more good learning, kind of that's, a little less formal, more resident driven, gives you good opportunity to give lectures as a PGY 2 and 3 and 4, also to get on your CV. We have a bunch of clubs to get involved in. We have an osteopathic OMT club after hours, usually around 5 or 6 after we have our continuity clinic. A few of the PGY 2s and 3s who are DOs run this. They've been doing an awesome job, super cool to learn, especially as an MD. We have a musculoskeletal ultrasound club that we recently started the last 2 or 3 years as well. So this will take place instead of grand rounds every so often, and you actually have the opportunity to give these lectures as a senior resident or a sports fellow, or Dr. Maxwell there, who's our sports fellowship PD, will give some interesting MSK ultrasound lectures as well. We've done some on athletic pubalgia, some on some different diagnosing median nerve carpal tunnel syndrome with ultrasound versus EMG. So some really interesting topics there. We also go to a ton of different national conferences, AAP, AAPM&R, and then AMSSM, ASKIP, all those. We really try to get involved with different posters for different case reports and doing some other more formal research as well. We do quarterly wellness, as it sounds, about 4 times a year. This was when we were PGY 2s. You got to go rock climbing. It's pretty cool. You get the day off on a Wednesday to kind of go reset and enjoy yourself. This is the one Marla and I just planned recently. A few weeks ago, we got to go do some pretty cool indoor mini golf, had all these bells and whistles. We had a blast. So we definitely, and there it is. These are our new PGY 2s enjoying themselves. We even get to do some yoga in between rounding and doing your notes. That's me front and center. Just a little embarrassing, but you got to stay flexible. Got to practice what you preach. So on the other side of things, we also have some more serious topics that we get involved in. We have the MedStar GME working group on racial justice. One of our PGY 2s is actually on the board of this. And they get to do some really great things, a lot of good outreach and advocacy here in DC. Also have a diversity and inclusion initiative at our program, and any residents able to get involved, which is great. We have an LGBTQIA house staff organization. So this meets, I believe it's every month or so when GME meets, and they talk about different ways to promote inclusion and diversity, which is great. And then just in terms of our program, preparing for the future and where we go after this. Sorry, I'm just going a little quick so we can save some time for questions at the end. But our last class did amazing. 2 match into pain, 1 at UVA, 1 UPMC, 1 sports medicine at the new Johns Hopkins Sports Medicine Fellowship, 1 did a pediatric rehab fellowship across the street. She's staying with us. And then 1's doing amputee rehab in Tampa, and 2 did some general outpatient near us. So we got a lot of people sticking around, which is awesome. For our year, we have 1 person who already matched in NAS, is unaccredited, the NAS non-ACGME spine fellowship with Emory. So we're super excited for him. Myself and 2 others are applying to sports. 1 person's applying to ACGME pain. And then Marla is applying for spinal cord injury fellowship. Just real quick, how our call works. You do a short call, which is technically from 5 to 10. Usually you're only there till about 7 o'clock or so, depending on how many patients we're waiting for to come in. You do about 3 hold notes. It's not too bad. Weekends, we split the Saturdays up. There's a 8 to 4 or 5 shift, and then a 4 or 5 to the next 8 a.m. And then you have your regular long calls, which are on the weekdays. Sunday has its own 24-hour shift. We kind of do a graded system. So you're doing majority of your calls as a PGY 2, and then slowly goes down. So 49 is a 2, 40 is a 3, and 18 is a 4. And that's including all of your short calls, long calls, and weekends and holidays. So we have a ton of benefits, textbooks, paid time off, sick leave. We get a ton of administrative days for job fellowships, up to 10. We get 7 days for conferences a year. So academics wise, like we really want people to learn and get out there. So there's no worry. We get about $900 a month in education funds. So there's a ton you can do. And MedStar will even pay for one conference if you're presenting. So I really appreciate everyone coming out. This is just a picture from our new class that just joined us here in DC, enjoying themselves. And if you have any questions, here are our emails. Please don't hesitate to reach out. I know it's just a kind of quick, brief presentation, but we'd love to hear any questions you guys have.
We have about 5 minutes left.
Perfect, thanks. So we got a couple of questions here, Kev. I will snag this first one. It says, where are some of the locations the Global Health Track team went to in the past? So our resident that just graduated, that was the first of PM&R that was in the Global Health Track. She had a planned trip to Namibia, was obviously canceled with COVID, but that was her plan for her trip. My location for my trip is to Colombia, Bogota, Colombia. And then we actually just started incorporating some more domestic trips as well, just given that like international travel is pretty hard right now. So working with like American Indians, Zuni Reservation in New Mexico and things like that. So there's really a lot of opportunity. There's really no limit to where you can go. You just have to set it up early within your track. But the MedStar pays for the whole thing. They support you. Dr. Wazatsky supports you with it. So you can really go anywhere as long as you have like a true project.
Yeah.
And then Kev, you want to take this next one? It says, where do the residents typically live?
Yeah, the cool thing about DC is there's a ton of neighborhoods, kind of like New York. Every neighborhood has its own vibe to it. I've moved around a few times in DC, and every neighborhood has so much to offer. You can walk around. People live in the Noma area, which is where I live. People live all the way on the other side of town in Georgetown. Some people live in Columbia Heights. So kind of all throughout the city. Navy Yard, people have lived in as well. If you have a family, you want to live in the suburbs, people live in Alexandria, Arlington, Silver Springs. There's a lot of great surrounding suburbs as well. So there's a ton of options depending on what you're looking for.
Perfect. And then I can take this next one. What sorts of things had the social medicine health equity track been involved in? So our most recent resident that was really working with this, Dane, he did a lot of work with our COVID-19 and like health equity within like the treatment of COVID, especially within Washington, DC. So that was probably the most recent project. It's really, these tracks are kind of built for whatever you're passionate about, whatever you like find interesting. But that would be the most recent kind of project that I'm aware of as far as like what somebody was doing for the health equity track. He did a really cool presentation on it. It was really interesting. Obviously a big topic with health equity with the COVID, All right, Kev, this one's perfect for you. What kinds of ultrasound guided procedures do you get exposed to as part of your ultrasound club MSK rotation?
Yeah, so the ultrasound club is more for kind of nuanced things. Like I said, like athletic pubalgia, which is now like non-specific groin injury, and you can do injections into different like adductor muscles that are tendinopathic, things like that. Looking at like nerve hydrodissection. So that's kind of what the club does. We also have an ultrasound machine in our resident room. So we have a lot of downtime. We're always scanning each other and working on our ultrasound skills. And then in terms of the rotations, you get to do pretty much any injection under the sun. Most of our people are doing a lot of spine floor procedures and ultrasound. So even recently I did an IT band insertional injection. You do all the bread and butter ones like glenohumeral, knee joint, all that type of stuff. And our Dr. Murtaugh is one of the Wizards team's doctors, and he does pretty much any MSK ultrasound guided procedure you can think of. So you get a ton of exposure here, which is great.
And then we got one more question here. It says, being in DC, are there any interactions with politicians for advancing medical legislation or things of that nature? That's a really interesting question. That's not really one of my particular passions, but I know Dr. Wazatsky is like very heavily involved in the AAP and is pretty heavily involved in like medical legislation as it pertains to physical medicine and rehab. So he would probably be better able to answer that question. But again, anything that you're interested in, anything that you're passionate about, you'll be supported here. And I think that would probably be a good topic for the the social medicine track.
That's all the time we have. Really appreciate your guys' time tonight.